Okay, this is the anterior surface of the heart. It's kind of hard to tell by the way the apex goes. What I looked at this. This is the pulmonary trunk. You can see the pulmonary trunk. It has to be anterior side. This, of course, is the aorta. I can see a huge branch coming off of it. And then posterior, notice you have this big indentation between the left atrium, right atrium, and the ventricles. So that would be your coronary, where your coronary sinus sits. So that makes that posterior. So that would make this superior vena cava. This is inferior vena cava. So this is going to be the flap-like structure, and this is posterior. So this is your right auricle. The chamber would be right atrium. You can see it here as well. So again, that's the right auricle, chamber, right atrium. This is your anterior interventricular sulcus or groove. So that makes all this the right ventricle. This is the left ventricle. So this is the left, the structure is the left auricle, chamber, left atrium. This is pulmonary trunk, okay, which of course is going into, you kind of see that moving, the right ventricle. The aorta, one of its branches, which you can't tell, but that's going to go to, I can go through the little valve, my probe. So this is the left ventricle. And even from this inferior view, you can definitely tell this is left. Look at the thickness of the myocardium versus the thickness over here on the right side. So even if it's open, you should be able to tell. So by knowing this is thin, this is the right side, that's going to make that the right right atrioventricular valve or tricuspid valve. These are the heartstrings, which we call chordae tendineae. Okay, you can see a good one here, another one there. Where they attach kind of on the side, that's actually a pretty good papillary muscle right here. These maybe look a little bit better. Good papillary muscles. Here's a good one as well. Okay, so this, look at the thickness. This is the left side, so that would make this valve your left atrioventricular valve, mitral or bicuspid. Let's see. This is the moderator band. Okay, it goes in just from the interventricular septum to the right side of the ventricle. Looking for some really good. That's probably pretty good. This textured muscle in the ventricle looks kind of shredded, not the heartstrings. That part, that is the trabeculae carnae. And I think the other heart has a little bit better. When it's like this is in the inside of the atrium. That was what we call pectinate muscle. Okay, if we want to do layers of the heart, right through this kind of glistening layer, you could say visceral pericardium or epicardium. If I have a pin in the middle of the wall, that is the myocardium. And if it's pinned from the inside, that glistening layer, that is the endocardium.